The Accidental Hero, Dr. Helen Chu. She's an infectious disease doctor at the University of Washington and lead researcher at the Seattle Flu Study. She's been part of the team studying how influenza spreads during flu season. The time, February 2020. Coronavirus is known to most Americans as the hangover you get after drinking too much Mexican beer with a lemon or lime wedge. The place, the Seattle metro area, a bucolic city in the western United States, known for coffee, a company named after a South American river, and for hosting the two richest people in the world. Dr. Chu's been thinking about the case of a man who traveled to the Seattle area from Wuhan, China, infected with the novel coronavirus. Dr. Chu has a great idea. Use the testing equipment and process of the Seattle Flu Study to look for more cases of coronavirus with the samples they collect from the flu study. Her colleagues at the University of Washington think it's a great idea, but the CDC and the FDA say no. The CDC said you need to ask the FDA. The FDA said no because the laboratory didn't have proper paperwork in place. Urgent emails and meetings continued throughout February 2020, but the answer was still no. So Dr. Chu did what she needed to do. They tested the samples anyway. They quickly found a positive case, and that set off a chain reaction. The experts decided to tell state and county health officials. They quickly determined that the teenager hadn't been to China and hadn't had contact with anyone who had, which meant the virus was spreading in the community. Testing ramped up, additional cases were found, an emergency was declared, officials began asking employers to have workers work from home if possible, and schools were closed. Public health officials would have found the cases eventually, but Dr. Chu and her team's actions accelerated the process, saving countless lives and limiting the spread of the illness to only 1 or 2% of the Seattle area population. Thousands of lives were likely saved. Dr. Helen Chu, an accidental hero.